Hello and welcome to Medical Shorts by Tutor IMG. In this video, I'm going to discuss about panic disorder. So a panic attack is basically defined as abrupt surge of intense fear or intense discomfort that reaches to the peak within minutes. So panic attack is abrupt surge of intense fear or intense discomfort that reaches to the peak within a minute. In order to make the diagnosis of panic disorder, the patient should have more than 4 of the following symptoms. So we use the mnemonic students, fear, 3 C's. That's the mnemonic which you have to remember that will help us to memorize the symptoms of panic disorder. So the patient should have more than 4 of the following. S for sweating, T for trembling, U for unsteadiness or maybe dizziness, D is for depersonalization and derealization. Depersonalization is the feeling of detachment from one's body and thought. Derealization is the detachment from surrounding environment. E is for excessive heart rate. N is for nausea. T is for tingling. S is for shortness of the breath. Fear of losing control, fear of dying, and going crazy. 3 C's stand for chest pain, choking, and chills. So in order to make the diagnosis of panic disorder, the patient should have more than 4 of the following. Coming to the treatment, so basically the treatment of the patient, we start with psychotherapy. The most important one is the cognitive behavior therapy. In pharmacotherapy, we have SSRIs, or we can give the patient SNRIs. They both are equally effective. But the problem is that for relief of acute anxiety, you have to give certain medication because SSRI and SNRIs takes time for the effect. So for acute relief of anxiety, you can prescribe the patient benzodiazepine for a shorter period of time. Once SSRI and SNRI start kicking in, you can taper the benzodiazepine and ultimately you take these medications off. So that's about the panic disorder. If you like this video, kindly subscribe to our channel, Tutor IMG, and thank you very much.